Let's take a look at Dove Cameron and see if any facial features have been tweaked over the years. We will discuss the cost of these potential procedures at the end. This video has been sponsored by Bright Sellers. More on them later. In 2013, at the age of 17, I'm noticing that Dove has really smooth skin, and that's really a telltale sign of youth. As people get older, the water content, the collagen quality, everything basically gets worse, and so that becomes more obvious as we age. I wanted to point out here that her nasolabial folds are there, and that's very much normal. A lot of times people try with filler to obliterate the nasolabial folds, but as you can see, in a normal 17-year-old person, they're there. So just something to keep in mind. Normal anatomy. I also noticed that Dove has great brow position and nice infrabrow fullness. That also adds to a very youthful look. I'm noticing that she has some mild telecanthus, and that's when the eyes, or the medial canthus of the eyes, are set a little bit wider apart. That is a very minor thing with her face, but something that I am noticing. She has great cheek volume, and her mid-face and lower face bony structure is excellent. Dove also has nice lip fullness, and notice how her lower lip here is fuller than her upper lip, and that's also very standard sign of normal facial anatomy. She does have thin nasal skin with some tip bulbosity, and we'll talk about that more later on. In 2014, at the age of 18, I'm noticing here that Dove has been plucking the eyebrows to a degree, and there are some dangers in doing that. Sometimes the hairs don't grow back, and some patients then resort to makeup, tattooing, or microblading, or eventually they might decide to do an eyebrow hair transplant to get some of those hairs back. So it's always a risk of plucking, especially starting early. She does have youthful lateral canthal positioning, and what I'm also noticing with Dove is that she has facial asymmetry, which we all do, as I always talk about in these videos. Dove is specifically left side dominant. So if you look, you can see that she has a left eyebrow that sits higher than the right side. She has a left eye socket that's positioned higher than the right side. Her left ala, which is the portion of the nose, the wing of the nose, also lifts higher, as does the left lip, and even the left portion of her chin, the bone, is sitting higher than the right side. And you can even see, if you look at the upper red lip, there is more fullness on the left than on the right. Dove does have some nice dimples, and this is possibly a natural trait for her. In 2015, at the age of 19, the fuller eyebrows are back, and the eyelashes look amazing too. On the 3/4 view here, we can see that she does have some nasal tip droop with smile, and patients often ask me about this in consultation. It bothers some of my patients that when they smile, the tip goes down. There are ways of securing the tip with surgical procedures, but that is something that I'm noticing here. Also, the lower lateral cartilages of Dove's nose are cephalically malpositioned, and what that means is that the orientation of those lower lateral cartilages is more vertical as opposed to being positioned more laterally and a little bit more on a diagonal. In 2016, at the age of 20, you can see that Dove's eyebrows are now more full. There's also the use of makeup to give the illusion of more fullness. I don't see any surgical changes occurring at this stage. Oh, this is going back to 2008 now. 12 years old Dove. She looks very different. We'll need to reassess this analysis. Just like I'm a fan of Dove Cameron, I'm also a fan of good wine, which is why this video has been sponsored by Bright Sellers. After you take a quick quiz, they match you with wines from all over the world, curated to your taste palette. They also send the wine directly to you, so you don't have to waste time or money at the liquor store buying wines based off of the label. I found the whole process of getting wines through Bright Sellers very efficient and fun. I love learning. So I found their wine education cards pretty awesome. Each box comes with wine education cards for each bottle that outlines tasting notes, suggested pairings, best serving temps, and origins. Bright Cellars' blog, Glass Half Full, is another resource to improve wine knowledge. Thank you, Bright Cellars, for giving our followers a limited time offer of 50% off their first 6-bottle box. Click the link in the description to get started. Thank you, Bright Cellars, for sponsoring this video and for giving us a chance to reinvest back into our YouTube channel. Taking a look at Dove in her early teenage years, I'm seeing 3 main features stand out. First is that the nose is larger. She has an obvious hump, and it appears that it was reduced before the age of 17. 2 is that the lips lack that degree of plumpness that we saw in that image at age 17, suggesting probable lip filler use. 3 is that the brows are positioned higher now than her original brows were. And notice how she doesn't have that upper eyelid hooding that she did in her early years. So this suggests a possible brow lift procedure. So now back to age 21. So since we look back and we see some evidence suggesting an older rhinoplasty procedure, now that I'm seeing her nose at age 21, what I'm appreciating is an inverted V midvolt deformity. So this is where the cartilage of the midvolt of the nose starts to be weaker from prior surgery. What can happen is that you start to see a thinness right into the midvolt here that doesn't look well supported. There are ways to counter that surgically, such as with spreader grafts or other techniques that can address that with like a revision procedure. The nasal tip also has some noticeable asymmetries. Given her thin skin, these asymmetries are more visible. You can clearly see that there's lip filler as well, and it's settling into that cutaneous lip vermilion border of the upper lip. In 2018, at the age of 22, I think that Dove may have had some possible mandibular implants for improved jaw definition. The definition that I'm seeing is not something that can easily be achieved with filler, and it also stands out from her jawline of the past. So I think she may have had a custom mandibular implant that most likely included the gonial angle, which is back here, as well as the body of the mandible. Please make sure to subscribe to our channel and turn on all notifications. In 2019, at the age of 23, I think that Dove may have had some chin filler because she no longer has that cleft right in the center of her mandible. She has a smoother contour there. This area is called a mandibular symphysis, and it looks like it's been at least partially filled. In 2020, at the age of 24, I'm seeing some signs of a revision rhinoplasty. Specifically, the tip to me looks now more refined. There is a more symmetrical appearance to the tip, and there is increased rotation to the tip, meaning that it's been pushed up. And one of the ways that we can tell is because there's increased nostril show. So from the frontal view and from the 3/4 view, there's a bit more nostril visibility, which does occur as the tip gets rotated up in many cases. In 2021, at the age of 25, I'm not seeing any obvious further changes. In 2022, at the age of 26, what I see here is some signs of buccal fat removal, because if you look at the area along, if you follow the oral commissure out laterally, that's the area of the buccal fat, and it looks like it's more caved in than her photos from before. So that suggests a potential buccal fat removal, and we have an entire video on my thoughts related to buccal fat removal surgery. Also in 2022, I'm seeing possible signs of cheek implants for Dove. There is some sense of a more rigid structure along the cheeks, which differs from that nice soft contour that she had previously. You can clearly see in the side-by-side image of Dove at age 12 and Dove at age 26 the major changes that have occurred beyond just the use of makeup and beyond just the natural aging and maturation process. And this is another set of images that we found that really shows you the major transformation that has occurred from 2011 to 2022. So let's talk about having surgery at a young age before we get into the costs of all these procedures. I've spoken to some young patients who are related in some ways to the Hollywood scene, and sometimes they tell me that, oh, my agent said I have to get this procedure done. To me, I see that as highly inappropriate. I like for the desire to do a surgical procedure to be derived from that person more intrinsically, rather than having these external pressures of agents or Hollywood or other people telling them they need to get certain things changed. And lastly, I'll say, as a father of a wonderful 3-year-old daughter, it is something that I think about when I see a young person like Dove getting all these procedures. How would I feel as a dad if my daughter said, oh, I want this changed, that changed, and, reconfiguration of the entire face? I don't think I'll feel good about that. The total cost of Dove Cameron's plastic surgeries is $155,000. We use our videos to educate the masses about plastic surgery, so if you haven't already, please subscribe to the channel. Since you like this video on Dove Cameron, we know you'll enjoy our video on Jennifer Aniston. Click the card and I'll see you there.